In this video, we'll show you how you can recognize sacroiliac pain in your own horse by looking at some clinical indicators that give you an idea that your horse have problems there. This is the result of some research we did over the years in our practice. It has been presented at the AAP conference in 2014 for like 6,000 veterinarians, all equine oriented veterinarians from all over the world, and it has been based on a lot of statistics on caseload from over the years in our practice. It's going to help you to give a good idea where to look for, and when you have an idea your horse might have iliosacral, or when your horse might have something else but likely not iliosacral. It's a simple test. I'll show you 6 simple indicators, 6 things that you can see. They're easily observed by the trained eye, meaning you need to know what you're looking for. After watching this video with all the examples video of those indicators and how it looks like in your horse, you can have that trained eye. So you can easily observe it and see if your horse has those problems. It's also easily scored. It's there or it's not there. It's not like, oh, it's maybe there, or I see 15% or something like that. That would make it really difficult. No, it's very easy. You see it, and if you wonder if it's maybe there, it's not there. That easy. It's present or not present. We have designed the test for sacroiliac pathology. When 3 or more of the following indicators are present, it's very likely, 90%, above 90% certainty, that your horse has iliosacral problems. When your horse doesn't have 3 or more of those, it's very likely your horse doesn't have iliosacral. So it really helps you to make a quick distinction like yes or no. The first clinical, very present thing to look at is tracking narrow behind. You will see it in walk, quite often you see it in trot, and what you see is one hind foot doesn't go perfectly normally forward, but it's adducted, what means it's pulled in front of the other foot. So it's more or less like walking on a cord. And we think this happens to stabilize the pelvic region and avoid excursion of the pelvis. So this is a thing a horse does when he has pain in his iliosacral region, or at least it can be one of those signs. This horse is going to show you the narrow behind. In the walk, it's not that obvious. When you look at it, you can see that it's not completely normal, and the hind feet are a little bit closer together. You also can see it has sometimes the tendency to drift a tiny little bit to the right. But the walk is, if you don't have a very good look at it, it's not very abnormal. It's a 4-beat walk, especially very obvious to see when it comes straight at you. Now we're going to see the trot, and now you can see much more what I mean when you talk about narrow behind. Especially the right hind is more or less put in front of the left hind. When it's coming back, you will see that even better. Both hind feet are more or less on one line. Number 2 is lateral walk. What you will see is that 2 feet on the same side move forward at the same time. That's like in a pace. And quite often it's most visible in the serpentine, sometimes only in one turn, always in the turns to the left or in the turns to the right. Sometimes it's visible in both directions. And in the more severe cases of lateral walk, you can quite often see it's very visible in the straight walk too. And if that's that visible, it could also be a sign of ataxia, having nerve problems. We think that this lateral walk is caused by a disturbance of the normal walk pattern in the spine. Normally the horse moves in a certain way. When a certain part of the spine is stiff, you certainly start to see that the normal 4-beat walk is not there, and you get more or less of that lateral walk. This horse is going to show you a couple of steps of lateral walk on the serpentine, especially on the left diagonal. You can see a couple of times, especially when it comes closer by again. I'm going to tell you now, every time I see a paralateral walk. Now, 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 now. This is another horse, shows that the same thing. He's a little bit more obvious on the left side. I'm going to say now, 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 now. Symptom number 3, or indicator number 3, are haunches in or out. Normal horses do walk, trot and canter on 2 tracks. The front and the hind limb are on the same track. When the horse is on 3 tracks, so more or less drifting to one side, the haunches are in or out to one side. And when we look at it, quite often on the straight line it's not that obvious, but when we put the horse on a circle, you can really see it. And very often it's even like that in one circle the haunches are in, and in the other circle the haunches are out. And we think that this is caused by a slight asymmetry of the pelvis, so one hip is slightly lower, and that makes it for the horse more comfortable to have the haunches out in one direction and bring the haunches more in the other direction. This horse in trot shows a very clear inside hind coming in a little bit more to the inside, so this horse is really haunches in to the left. And in canter it's even more obvious. You can see that the haunches are really making like a meter circle, a circle of a meter smaller than the front end is doing. So clear video of haunches in. Here we see it in another horse in trot, and also shows very obviously that inside hind making a smaller circle than the rest of the horse, and so haunches in. And horse number 3 is doing the same thing with a little variation, that he also puts his inside hind really in the midline, more or less in the middle of the 2 front feet, like the narrow behind that we saw in an earlier video, but still brings the haunches in. So you saw 3 horses doing the same thing, haunches in. Number 4 of the indicators is an asymmetrical tail position. Normal position of the tail should be in the midline. Sometimes it's a little bit elevated, so you see it a little bit off the butt, but it should still be quite in the middle. What we quite see as indicating of something abnormal is when in a straight walk the tail is to one side, or even more when we do a serpentine. Normally in the serpentine the tail should go to the left in the left turns and to the right in the right turns. And what we quite often see in this case is that in the serpentine the tail is locked to one side. It stays to one direction, whatever direction you turn. And we're quite sure that this is an involvement of the sacroiliac ligaments and maybe some nerve tissue that makes it that it's for the horse more comfortable to carry the tail in one direction. And some horses have had surgery to their tail, and as a result that the tail stays to one direction. That doesn't really count in this thing. We really look for without having had surgery to a tail. This horse has the tail to the left, and even when it moves to the right, the tail stays to the left. Indicator number 5 is the bunny hop canter. In a normal canter, we have good separation between the footfalls of the hind feet. One foot clearly lands a little bit earlier than the other hind foot. And in the bunny hop canter, what we see is they're nearly coming together. The horse moves as a bunny and quite often also has the croup higher. We think the horse does this to avoid rotational forces on the pelvic structures. Now we're going to watch a bunny hop canter. First to the right, and you can see the hind feet more or less land at the same time. They're also very close together. The front legs have much more distance in between where they reach the ground than the hind legs do, And when you look in the other direction, it's very obvious. You also see the butt high. The horse is not having a normal canter. This is really what we call bunny hop. Number 6 and the last clinical indicator is reduced lumbosacral flexibility. And normally in a horse, the lateral and ventrodorsal mobility, meaning moving sideways and up and down, should be symmetrical. The horse should be able to do that to both directions with the same ease. When this doesn't really work properly, we see an overall flexibility decrease. Quite often people tell me the horse is stiff. But we also quite often see is the presence of a guarding mechanism. And you want to make the horse move sideways, and in one direction he really is not doing that, holding back, not moving it. And the horse is doing that to avoid mobility of the lumbosacral region. It's painful, so they don't move it up and down or sideways. This is to show lateral flexion. You can first flex it to the left, pulling on the tail, having one hand on a pelvic bone, and you see he's resisting this motion a little bit, especially when we're going to compare it to the same motion to the other side. Now you can see, especially after insisting for a little bit, that he moves much more sideways to the right and also more flexible. When we look at the ventral mobility, we take a pen and go over the back and over the butt. And what you see here is that when I do it on the left side, he doesn't want to come under, he moves completely sideways. While if I do the same exercise on the other side, you can see he comes under and doesn't move sideways. As a conclusion, we can tell you that if your horse, if you look at those 6 indicators, and all 6 indicators have been shown statistically in a large amount of cases over the years in our practice, that those 6 indicators do have a value in predicting the chance for sacroiliac problems being there or not being there. And it's very easy to look at it. What we have figured out is if there are 3 or more of those tests are positive, you can see 3 times or more, you say, yep, it's there, it's present. That's a clear indication for a problem in the sacroiliac region. On the other hand, if it is less than 3, only 1 or 2, it's not any indication of iliosacral. It's even likely something else is going on and not SI. It's also good to realize that many other problems may still be present. If this test is positive and your horse has really iliosacral, he can have other things too. He can have hock problems, he can have fetlock problems, maybe even laminitis, all kinds of things not related to sacroiliac, and it's impossible without tests to tell you that. So what you need is a good clinical exam by a sports medicine veterinarian, somebody that really knows how to look at a horse and do a good exam. What means like half an hour or more, doing a lot of tests, flexion tests, looking at the horse, lunging them, walking, trotting, serpentines, all those things that make it easier to look at least those 6 indicators, but also at other things. And what you quite often need after that is imaging. You need sometimes X-rays, very often ultrasound is needed, sometimes a bone scan is needed. The test is only to give you an indication. It's likely your horse has a problem, but it doesn't tell you exactly where. You need to do more to figure out if it's in the iliosacral, is it in the ligament, is it in the joint, is something else is going on too. It's not a completely do-it-yourself test, so now you know it's iliosacral, you know exactly what it is. You know, you have a good indication it's there, but other things might be there too.